Hi, welcome to Healthy Living. I'm Amy Bouton with St. Tammany Health System, and on today's Healthy Living, we are going to talk about November, which is Lung Cancer Awareness Month. And St. Tammany Health System this year is having our inaugural Lung Cancer Awareness Month, St. Tammany United in Pearl. So to kind of highlight some interesting things about that Awareness Month, educational opportunities, screening opportunities, and prevention tips, we're going to talk to three people today. So our first guest today is Dr. Gordon Wadge. He is a hematologist oncologist, and we're happy to have him join us here today. Welcome, Dr. Wadge.
Thank you, Amy. I'm happy to be here.
Good. Thank you so much. So tell people a little bit about you and what you do.
So I'm one of the medical oncologists within the Ochsner system, and I see both patients with cancer and patients with blood disorders over at the Ochsner Cancer Center in Covington.
Okay. So we had a recent announcement in June of this year about a partnership with St. Tammany Cancer Center, a campus of Ochsner Medical, Ochsner Health System, and MD Anderson. So we want to talk a little bit about that partnership and what that means to not only our patients, but also to clinicians like yourself. So.
Oh, sure. So the MD Anderson and St. Tammany and Ochsner partnership has been about 2 years in the running as far as getting established. And so the partnership, and MD Anderson's it's a perfect partner for us in this region. They're kind of the gold standard. They are the gold standard within the region, and so to be able to partner up with them is very helpful with the cancer care in the region. And so a lot of the behind the scenes work has been updating the Ochsner Cancer Center and St. Tammany with the protocols and practices that the MD Anderson group provides, and so instituting that as part of our workflow.
So all of that, when you talk about 2 years in the running, that's part of the process, correct? Updating all those standards and things like that.
Right. So when Ochsner and MD Anderson initially started to collaborate, there were different things that the MD Anderson group felt that we needed to upgrade and update. And so during that 2-year period, Ochsner was upgrading protocols and some of the practices to reach that MD Anderson standard. And so once they've were able to kind of reach that point, they decided that the partnership was something that they wanted to announce to the.
Okay. So the St. Tammany Cancer Center, campus of Ochsner Medical Center, is the pinnacle of cancer care here on the North Shore already. And this partnership, can you tell people as patients who might receive care there, or people who know people who need care that might come to St. Tammany Cancer Center, how is this transformational for the Cancer Center?
Yeah, so with the MD Anderson partnership, we've instituted these multidisciplinary approach, and so we have a lot of physicians from different expertise and different specialties that collaborate together in the care of cancer patients. We have tumor boards where we sit down and discuss individual cases, and that's part of the MD Anderson model. And so that's been very helpful in getting everyone together to discuss patient cases all at once.
So multidisciplinary care, for someone who may not be familiar with the term or who doesn't understand necessarily what that means, you describe some of the components of that, the tumor board and collaboration. So if someone comes in and they are diagnosed with cancer, it's not just Dr. Wadge in the room saying, okay, this is what we're going to do, the end. There's a little more to it than that. Can you kind of describe the multidisciplinary approach kind of step by step?
Sure. So when the Cancer Center was built and it was envisioned, it was thought of as a way of incorporating all the different specialties under one house, and that includes medical oncologists, radiation oncologists, the thoracic surgeon, the surgical oncologist, and various other specialties. With patients that come through the clinic, we're able to have them see all the different providers within a multidisciplinary approach all on the same day or around the same time to really expedite their care and to get an opinion from all the different providers that would be involved.
So that's a collaboration under one roof, and at the same time benefiting the patient. You have that collaboration, but you also have sort of a lifting of a little bit of the stressor of having to go from this place to this place to this place. So it's all in one spot, basically.
Correct. I think before the Cancer Center was created, we had all these specialties here in the North Shore, but patients would have to go from location to location to see all the different experts. And so this really provides ease of access for our patients.
And I guess it opens the lines of communication a little more. Would that be fair to say?
Oh, yes, and that's correct. I mean, I think we have a very good working relationship with all the other physicians in the clinic, and we'll often discuss cases even before patients come into the building, so that we're all in agreement of the plan moving forward.
Can you describe the tumor board a little bit? What exactly is that?
So there's multiple different tumor boards that we have during the week. We have thoracic tumor board, GI tumor board, and what we do is we sit down with both the medical oncologist, the radiation oncologist, the surgeons that would be involved, as well as the radiologists, the ones that read the imaging, and we all discuss the cases, all the intricacies of each individual patient, and then we have the input on all the different providers of what's the best approach, whether we should start with one modality of treatment versus another.
Okay, so as an oncologist, hematologist, oncologist, you've probably been doing this for a long time. How does MD Anderson now fit into this? I know we talked about all the things that have come together, but integrating them into what we have already been doing, how do they fit in?
So yeah, so the MD Anderson physicians have instituted protocols and practices that we now institute, meaning that there's certain patients that we necessitate going through these tumor boards based on certain criteria. We also have access to trials. We have state-of-the-art trials for individual patients based on their cases. We also have access to technologies to help our patients. We also have access to the MD Anderson's physicians themselves. So if we have very unique cases that require a high degree of expertise, we have direct access to some of their physicians to discuss individual cases.
Okay, so that's another open line of communication and yet another collaboration.
Correct, and me personally, I find that very helpful with very specific cases.
So as a patient, let's talk about the patient who's coming to the cancer center. What would you say this means for care on the North Shore, cancer care on the North Shore now?
Yes, I think we had very good cancer care prior to the MD Anderson partnership, but I think this really helps increase and sets the bar on the North Shore. So I really do think that it has really improved care and access and allows patients to get all that treatment closer to home. They don't have to worry about travel. Everything is here local. And
so real quick, we're coming to the end of our segment, but I want you to say, as a clinician, what does that mean to you as the provider of cancer care, this partnership and this facility?
So yes, I mean the facility's been great. I mean it's been a great place to work and collaborate with all of our different partners. It gives us an extra level of comfort knowing that if there is a very difficult case that doesn't fit, we would say, the textbook, that there's always somebody else that we have access to collaborate with and get their opinion.
Well, I certainly appreciate you coming on with us today, Dr. Wadge, and thank you for your perspective on the partnership and on what it means for patients and for providers like yourself. So thank you for being here, and everyone, please stay tuned because we're coming back. We're coming back with Missy Moore, and she's going to talk about pulmonary rehab. So we will be right back.
Innovative healthcare isn't just about robots. It's about people. And world-class healthcare requires a world-class team. We're constantly implementing innovative programs designed to develop and mentor the best and the brightest. We take care of our team so they can take care of you. The St. Tammany Health System team is going places, and our patients, well, they're going home.
Welcome back to Healthy Living. Now we're here with Missy Moore. She is our Director of Cardiopulmonary Services in our sleep lab, and we're going to continue our theme kind of talking about lung health. So welcome, Missy. Thanks for being here today.
Thank you.
Let's talk about what you do. What do you do for St. Tammany Health System? And tell people a little bit about yourself.
I have lived here in St. Tammany since 1978, so I've been here a long time. I worked at St. Tammany for 26 years. I oversee the cardiac and pulmonary rehab program at the outpatient pavilion, and I'm also over the sleep lab. So
okay,
been doing that for a little while now.
So tell people where the outpatient pavilion is and the sleep lab, because I'm not sure if most folks know that.
The outpatient, cardiac and pulmonary rehab is at the outpatient pavilion, which is right off of Bootlegger Road,
okay,
where the new ambulatory surgery center is being built. And sleep lab is over near Flowers Estates by 80 Gardenia Drive.
Okay. So we, as you know, November is Lung Cancer Awareness Month, and we are going to recognize that month with the St. Tammany United and Pearl Recognition Month and the 2023 Power of Pearls Lung Cancer Walk. And we want to talk about lung health in general. Before we talk about any kind of pulmonary treatment, anything like that, let's talk about what we can do to keep our lungs healthy, because I know you know, and you probably drill it home to your patients. So
the first thing is maintain a smoke-free life. If you currently smoke, quit smoking. If you don't smoke, continue to not smoke. That is the first thing. Exercise is very important, even if it's just a mild, like 30 minutes, 20 minutes, if that's all you can do, that helps with your lung health. Doing your regular checkups with your physician, that is also, something that helps, because a physician can catch, regular screenings, all of that. And then also avoiding, air pollutants. If you're, in an environment that, is, got a lot of pollutants, some people live in those type of environments or near something. And so avoiding exposure to that as well. So those are the main things that you can do to help promote, having healthy lungs.
okay, so when we do talk about pulmonary rehab and the things you do to help their patients recover some of that usage of their lungs or capacity in their lungs, I'm not sure what the exact terminology is, lung function. So especially as it relates to lung cancer, how do you play a role in someone's recovery from that?
So basically what pulmonary rehab, our goal is to help to improve that lung function, decreasing severity of symptoms, and improving patients' quality of life. And so the role that pulmonary rehab plays in that is a patient will come to us if they've had lung cancer, surgery or treatment or something like that. They can come post-treatment to help increase their strength and endurance and stuff. And it's monitored exercise. It's a multidisciplinary approach in a sense that we have nurses, respiratory therapists, exercise specialists there, equipment, and it's done in a group setting.
Okay.
We also do education. And this helps to, increase that awareness of your lungs and what you should be doing to maintain that healthy lifestyle. So.
Because I'm sure after you have a diagnosis like lung cancer, or perhaps even a pneumonia, or maybe even COVID. I mean, I had a relative who had COVID, and they had a lung issues for quite some time. Your life is different, and you have a big awareness now of what your lungs did before, and now what they can do now.
So what helps with what we do is so activities of daily living are something that some of us take for granted because we do it every day. People who have lung disease or have gone through, cancer treatment, they suffer with shortness of breath that can be so debilitating that putting on your shoes is very difficult. Taking a shower. Different things that you take for granted that people have to sit down. So we try to help them with tips on how to go through just regular activities in a day, and that is something with the education portion, and with the exercise they get stronger, so therefore it's not as taxing on them.
So this, what you do, you're kind of touching on it, how it impacts the patient in their life. So your goal, like you said, is to see improvement. How much improvement do you see generally? Or I'm sure it's on a case-by-case basis,
it is,
but what can someone expect?
Sometimes we measure things. We do pre and post measurements. So we do sometimes see very little change. Sometimes if somebody maintains there and it's not progressively getting worse, that's a plus for them. I guess people have different goals, and we try to meet patient individual goals and then our goals as well. A lot of times we'll have patients come in, they might be on 5-6 liters of oxygen, and then we can at least maybe get them down to 2. So decreasing that is a goal. Sometimes they want to be completely off of it,
right?
And it might not be possible, but to decrease the amount is it is a plus. It is a positive thing. Sometimes people improve their lung function by 20-30%. It just depends on the lung disease, what's been going on and what's happening. So
And yeah, when we talk about that improvement, you talked about the day-to-day activities. I know that some people, we talked about a story of a lady that you guys helped, and she loved to travel.
yes,
Loved to travel.
Yes.
And then when her lungs were impacted by, I don't remember the disease that she had, but she went to y'all, and she is a testimony. She gave a testimony
Yes.
about how your rehab helped her to regain that portion of her life
yes,
back.
yes. And that's that. So that emotional and mental aspect also, because you're connecting with people who have similar problems.
Right.
Not everybody has trouble putting on their clothes in the morning and taking a shower. But if somebody who has emphysema or has gone through cancer treatment, they're suffering from that, and you've got them and you're on the bike next to them and you're talking and you get, but you get to be around people who have similar issues. But you also have the team that we have that have been doing this for a while, and the support that you have from them is also, it's an immeasurable amount, I guess. I
Yes.
can't put, it's kind of,
It sounds like relationships
Yes,
form.
yes, there are,
And,
yes.
in addition to their own family support or whoever they have supporting, they have that extra layer of support from
Yes,
y'all.
yes.
And they can depend on you for that. So that's
definitely,
good.
definitely.
So if someone needed your services, I would imagine that it starts with their primary care, who would refer them out to rehab services.
Yes.
But how would they ask for you or request you or get to you?
They can, they could call, or obviously if the physician puts the order in, we'll reach out to them. But you want me to give the number?
Sure.
Or it's 985-898-3780 is our main number. And if anybody has questions, they can call, and they'll, one of the staff will, be able to answer any of the questions that they have specifically. So.
All right. Well, is there anything else that you want to add about this conversation, the topic of pulmonary rehab, education, resources, anything like that?
I think one of the things that we pride ourselves in is our team approach to taking care of the patients, and we treat you like you are, one of our family. That's how the staff at the, it's cardiac and pulmonary rehab, but in the pulmonary rehab too, it's just an approach that we all are very much a big team, and we take it very personally in how we take care of the patients. So I think that that's a big part
That's what makes that connection
and we
happen.
enjoy what we do. So
Good. Well, thank you so much, Missy, for being here. We appreciate it.
thank you.
And thank you for watching. Stay tuned because we have another segment coming up. We are going to welcome Caitlin Hunter. She is our Healthier North Shore Ambassador for our 2023 St. Tammany United in Pearls Awareness Month. So we'll be right back.
Kids should be seen and heard.
At St. Tammany Health System,
Many kids are being treated like, well, kids. We're not little adults,
they have the North Shore's first kids-only ER.
And ICU. They even have a parenting center.
Kids aren't the only ones who need to go to school.
Together with their partner, Oxnard Health, St. Tammany Health System makes it easy to be on our side. On this side of the lake.
Hi, welcome back to Healthy Living. Now I'm here with Caitlin Hunter. Caitlin is a corporate affairs representative for Chevron, but she's also connected to us this month. She is our Healthier North Shore St. Tammany United in Pearl Ambassador. So welcome, Caitlin.
Thank you for having me.
Thanks for coming. We appreciate it. So you know that we are celebrating St. Tammany United in Pearl, and we reached out to you to be our ambassador because we know your story, but I want you to tell people why you decided to be our ambassador for our inaugural awareness month about lung cancer.
Sure. I have a really unique story. Both of my dads passed from lung cancer, and both of them could have been could have prevented it by having a low-dose CT scan earlier in their treatment process. So just like going to your annual physician every year or getting a mammogram, it should have been part of their portfolio as smokers. And I really want to raise awareness for low-dose CT scans to ensure that people prolong their lives and are able to be around for those milestone events that both of my dads are missing.
Yeah, so it's very, very personal to you. And you have knowledge of the low-dose CT scan, which is something that we're trying to raise awareness about with this Awareness Month. St. Tammany United is educate, screen, prevent. That's what we try to do. So the education part is, you know, you're talking about the low-dose CT scan. If you meet a certain criteria, you can get that low-dose CT scan, and it can detect the earliest of cancers.
Absolutely.
And start treatment right
Absolutely.
away.
Yep. And I know that St. Tammany Parish Hospitals is doing an event on November 11th, and you can call 871-LUNG to set up your low-dose CT scan, so you can learn more about that.
Yes, and so when you come out to our event, so St. Tammany United in Pearl is raising awareness, education, screening, prevention, and we're going to have the 2023 Power of Pearls Lung Cancer Walk at Fontainebleau State Park on November 4th, and you're going to be there, correct? And you're going to tell the multitude of people there your story, and also you'll have that opportunity to get assessed to see if you qualify for that screening. So it's a pretty simple assessment, right?
Absolutely. And I think everybody should do it. Non-smokers are 20% of cancer patients for lung cancer. And so those people who think that they might have no real need to do it should just do it and add it to their annual portfolio. I do it. I've never smoked, but I want to make sure that should anything happen early, that it's detected and I can be there for my daughter.
So we definitely appreciate you being part of this. So what is it that you'd like people to know about why the month is so important, aside from the fact that, you know, go get screened, you know, if you're a smoker, this or that. I know we talk a lot about telling people that are the audience who are smokers or who may have been exposed to some chemical, but what about the people around them who know someone? So can you speak to that?
Sure. I think Lung Cancer Awareness Month is really important, and I'm really excited about the United in Pearl campaign. I'm hoping it takes off and has the visibility of something like the Komen Breast Cancer Walk, raising awareness and education for low-dose CT scans or lung cancer in general, because of those who do smoke, don't smoke, or may have been exposed to something, could really help extend and prolong their lives. Excuse me. I'm really happy to be an ambassador for it because I feel like my story reaches a lot. My dads were both very special to me. My biological dad was a special ed teacher at North Shore High School for 34 years. He had retired for 3 and then found out he had stage 4 lung cancer. My stepdad was 56 years old when he passed, so he had a full life to live.
Right.
And if my story helps one person go get the scan and discover something early, I feel like I've done my job.
And what would you say to people who say, you know, my uncle's a smoker and I see him at Thanksgiving, but it's kind of weird to say, you know, you should go do this, or he used to smoke, or she used to smoke. What would you say to that person?
It's a little awkward, and while we're not here to bully smokers, those are choices people make. We do have the technology and tools to screen people to make sure that they can prolong their lives. Yes, smoking's bad. No, they shouldn't do it. Yes, have the awkward conversation. So my husband's father is my last surviving father, and I put a lot of pressure on him all the time and tell him, you're my last dad. You're it.
Right.
So this is big for me. And he's a casual cigar smoker. And so I make sure that he goes and gets his screening, and he always calls me after he does it to tell me he did it, and then calls and tells me with the results. And I couldn't be more proud of him for admitting that he should go in and get screened, just so he could say to me that he was proud to do it.
Right.
Having those awkward conversations are important.
Yeah.
And if you want your loved one to be there longer, bullying in an appropriate way.
In an appropriate way.
Don't make them feel bad about their choices, but let them know that, you know, there are these options available.
And we do want to talk about that because, you know, there is a stigma behind it. And we don't want people to feel that they're alone in this battle, maybe because of their choices, but maybe not. It's, you know, there's a high percentage, as we talked about, that are non-smokers. So let me just show what our t-shirt's going to look like, because we do have a t-shirt, but I want to show our tagline for it. And it's called No Grit, No Pearl. And that kind of represents just what you were saying. You're going to have to fold it like the Gap again. But that kind of represents exactly what you're saying. There's no hardship. Without hardship, there's no beauty. And we know that people who are on a lung cancer journey are in a difficult situation because they have maybe that stigma of judgment, which we want to lift that stigma. We want to lift that judgment. We want to say, listen, whatever you think you might have done to contribute, don't worry about that. You've got a community that's supporting you, and we want you to come out, and we want you to get assessed, and we want you to get screened.
And I learned that 1 in 4 St. Tammany Parish residents are smokers. That's a big number.
That is.
That is somebody you know, that's a couple people you know, and possibly 3 people you know. And so spreading the word and doing the grassroots of go get screened, or come join us on November 4th at Fontainebleau State Park.
Right.
And celebrate those who have passed and learn more about how you can be a part of the movement or how you can get your low-dose CT screening. Those are really important things that you can do to take action and help kind of change those numbers.
Yes. So this is our first year, and we're excited about it. We're excited about our inaugural event. We kind of talked about why we hope that people come out. We want to let people know that this event is free and it's open to the public. Is there anything else you'd like to add around this topic, around St. Tammany United and Pearl, around your personal story?
I'm just so pleased to have the opportunity to tell my story. And if there's anything that you walk away with, is really give that number 871-LUNG a call. On November 11th, low-dose CT screenings with St. Tammany Parish Hospitals. Start young, start early, get it as a part of your routine, and hopefully you walk away and celebrate those milestones with your family.
Okay, well, thank you so much, Caitlin, for being here with us. We really appreciate it. I want to give a few more details about the walk. It's November 4th. It's at Fontainebleau State Park. You can go to sttammanyunited.org to find out more. And the event that Caitlin talked about is National Lung Cancer Screening Day. So that is November 11th. You can find more about that information at sttammanyunited.org as well. You have to be assessed for a lung cancer screening, and there are conditions that apply, but those will all be explained to you. And these t-shirts that we talked about are for sale in our St. Tammany Hospital gift shop on Tyler Street. The front says St. Tammany United and Pearl, and the back says no grit, no pearl. And of course, we're from Louisiana, so we like that oyster, and that's where the pearl comes from. So again, Caitlin, thank you so much for being here. And thank you all for joining us for Healthy Living. We will see you next time.